subchondral bone erosion, pannus invasion of cartilage, chondrocyte proliferation, laxity of ligaments, joint instability, contractures, decreased ROM range of motion, systemic complications. Now discuss about the signs and symptoms. Symptoms and signs of rheumatoid arthritis. The joint of hands are often the very first joint affected by rheumatoid arthritis. These joints are swollen, red, and tender when squeezed. And also, we can see in the pictures deformity of the head, swelling due to synovitis. RA hand. Now we can see in these pictures deformity of the hands, and deformity has been on PIP and DIP joints, thickened synovial membrane, synovial fluid, and degraded cartilage. Also, this is the deformity of the RA hands. Swan neck deformity. The deformity arises from hyperextension of the proximal interphalangeal joint while the distal interphalangeal joint is flexed. Mallet finger, botnier deformity, swan neck deformity, all three is the deformity of the RA in fingers. Mallet finger. Mallet finger is a simple flexion deformity of the distal interphalangeal joint preventing extension. Z deformity of thumb. Severe hyperextension of the interphalangeal joint of the thumb. Fatigue, joint pain, joint tenderness, joint swelling, joint redness, joint warmth. Joint stiffness, loss of joint range of motion, many joints affected, polyarthritis, limping, joint deformity, both sides of the body affected, symmetric. Next is diagnosis of RA. First is X-ray. X-ray of hands and feet are generally performed in people with RA, magnetic resonance imaging, MRI, ultrasounds. X-ray are a form of ionizing radiation that can penetrate the body to form an image on film. A blood test, rheumatoid factor RA is a specific antibody in the blood. A negative RA factor does not rule out RA. Arthritis is when called seronegative, most common during the first year of illness and converting to seropositive status over time. Anti-citrullinated protein antibodies like RF, this testing is only positive in a proportion of all RA cases. Unlike RF, this test is rarely found positive if RA is not present, giving it a specificity of about 95%. Other blood tests performed when RA is suspected: erythrocytes, C, reactive protein, full blood count, renal function. First is ESR, the rate at which blood cells precipitate in R period. C, reactive protein, a protein found in the blood in response to inflammation. Full blood count, give information about all blood cells. Renal functions, kidney function, liver enzymes, gives information on the state of patients' lives.